So, here, let me fold these up a little bit.
Yeah.
Screw through. Okay, perfect. That's nice having a little bungee in there. So, I can find the fibular head. And I don't have to worry too much about up here right now. We're going to be worrying about this. Naturally, I have better access to that structural half. So I'm thinking, there's the 2, and just visualizing the long bones, and right around there, because I can find where that metatarsal ends quite easily. Right there. So then that's where the tarsal bones are. And there's a big muscle that sits right on top of here related to extension. It's a little extensor digitorum muscle, all that. And then just having awareness, those malleoli, that's where a lot of tendons have to come around. There's a bunch of tendons that are just anterior to the lateral malleolus, and there's some tendons that are just posterior to it. The medial malleolus, they all are posterior. But there's not tendons that run anterior to it until you come all the way over. So, getting 2 for 1. I know that the fibularis muscles do eversion when they shorten. Why not, as I'm doing this eversion action at the ankle, make sure I'm putting some stress on those tarsal bones. So cuboid and the 4th and 5th metatarsal. I lost lotion. I'm stiff. We were doing a bunch of yard work. All right. Now, here, tibia, easy to find. And then there's the anterior compartment, and then there's the fibula. And so then there's that lateral compartment. And my orientation is just the same thing at length has been, is it more of a 90-degree contact or a 45-degree contact? The 45-degree contact is going to hit that anterior compartment. The 90-degree contact is going to hit the lateral compartment. And I just have to do both of them. Maybe I combine the 2 and make it look like one glide, but I'm thinking about those 2 compartments. Not even the individual muscles, just that anterior group and then the lateral group. Anterior group and lateral group. The actions I can do at the foot, I can think about the eversion inversion or the plantar flexion dorsiflexion. Let me see what the normal sized human has. Some of the bigger people, their foot would be here, so I could just hook on and I would just move my elbow back and forth, and that would move the foot in dorsiflexion, plantar flexion. So, not too bad. Yeah, right there. Just grab the heel or the calcaneus, and then as I'm applying pressure, I can incorporate a little bit of dorsiflexion, plantar flexion. Get a little more motion. All right. The knees here, we've talked about that before, how you can kind of cover almost everything here. Just like how we had done reaching across the table to the opposing lower leg and doing the knees for like the calves and shins and that position. This just gives you way better leverage. I can get a way better pull on gastroc and soleus. I tend to feel like this one feels the best compared to most of these. But that ends up being against the grain for all of these muscles. And then this will be more or less with the grain. Yeah, that'll be more. So now I'm changed how I'm going to hold. This one just wasn't working for me. So I'm going to hold more here. I kind of hug around the first metatarsal or the ball of the foot, and we're going to use that as my handle. And the added value of that one is as I'm moving this, I'm moving all those metatarsals. I can kind of just play around. I can even go and you can't see it too well, but I can focus the attention at the big toe, which, as you've heard, the big toe has a lot of its own specific muscles, right? So if I'm trying to unstick things, I have a compartment here. Even if I couldn't remember all the muscles, I could go, well, some of them are about the ankle, some of them are about all the toes, some of them are about only the big toe. So ankle, all the toes, just the big toe, or more or less. I could just kind of weave that all in. And this is the, which side is the?
It's this side, but I'm not really feeling anything.
No, it's gonna be more on the medial side. All right, now we're gonna come more on fibularis, and that's where I can incorporate this. Make it even easier on myself and just push the foot that way, down into the bolster. And these feel like they're doing okay. On prior assessments, what we found with her, she's getting really pulled into inversion. So this is all probably long. And I'm just confirming that stuff isn't stuck together there. And it isn't. So it's gonna be more along this line. So, visualizing all that, remember how that fifth metatarsal has that big giant tuberosity on the lateral side? I can feel that here. There's a muscle that connects it to the calcaneus. I'll just apply with my palm, pressure right there. That is one, compressing a muscle, but also stabilizing calcaneus. And now I just move that fifth metatarsal back and forth. It works and it feels really good, but it's more profound than just okay. Let's go pay attention to this one. Okay. Circulation. Still circulation, right? Yeah.
Yep.
Now, you've seen, I've preached enough like the angle of application and how to use like the soft fist to work through here. So more what matters is you thinking about the secondary movements that are coming along with this. Now, small sidebar, with lymphatic drain, most of the channels and lymph nodes, especially up at the hip, are more medial, so this actually is the better angle for all of that. You have a much better position for manual lymph drain and sideline. The gravity, everything, much better in this orientation. So I would really say usually for lymphatic drain, sideline and supine, because you could put like the big bolster under all the lower leg and get the legs above the heart, the lower legs above the heart. Those are the better positions for lymph drain. It's one aspect of, let's say you are in like the classic sideline only position with prenatal, there's not a whole lot to do for the low back during that cycle. I need to think about breathing and some lymph support. That's the best thing I can do. And feet. Help those feet and hips and knees out, so they can help adapt to what the pelvis and the low back are doing. So I'm starting more in a broad application here of just lighter pressure using a palm. I turn my hand over and I'm letting the pressure go more, for me, medial, but it's more posterior related to her body. Trying to kind of just gently pull everything away from the tibia. Trying to pull all those muscles away from the tibia. And at the same time, look at my left hand. I just keep sprinkling in the secondary compression. The deeper muscles come down to the arch. Pin, stretch, pin, stretch. Related to lymphatic drain, the bottoms of your feet are their own plexuses. They're like sponges that every time you take your foot off the ground, they fill with fluid, and then when you step down on them, you're squeezing the sponge out. So the more foot compressions you can do, the more you're doing lymph drain. So right here, applying pressure along the arch of the foot, right there where the canal is, and then just moving the first metatarsal back and forth. And it's real gentle and rhythmic. But plantar fasciitis, this is the kind of stuff that where I actually saw results. Just thinking like this, not just digging right down on that particular isolated spot. So soft fist, finding calcaneus, looking for that channel. Gonna let myself just go downhill. Just moving that big toe. As I move, if I just do this, I'm not really gliding very much. If I pull the tissue under my hand, it actually creates the glide. Then, the best one, little bit like in prone, protect and bolster the toes, and bring that forearm in. Cross, and down. Change my angle, gonna start here and go towards the calcaneus. Go more perpendicular on a slight angle, and then parallel. I could probably do that for 10 minutes and nobody would complain. Just slow it down, increase or decrease the depth. Come back. And good. What I forgot to do here. Yeah, can't believe I actually forgot it. This one. So, this is the left leg. I'm going to put my left hand under my right hand on top. Now, yeah, you can see a bit in the mirror. Now I can create this curl effect with my fingers, and that's where the point contact, and the point contact is going to be predominantly my third and fourth finger. I find what I want to work on. Is it going to be right at that center line where the tarsals should be more pliable, because there's the more mobile half near the big toe, on the side of the big toe, and the more structural half here. So that's what I tend to start with. So I try to visualize that I'm between the metatarsals and tarsals related to the fifth and fourth versus the third, second, and first. I can't believe I said that right. Then I just hold that down and push to bend those fourth and fifth ones over top of it. For reflexology, I would much rather do it like this, the point work related reflexology, than somebody supine and try to dig with my thumbs. I can find those points just as efficiently using these fingers as opposed to my thumb. So now I'm going to be more on the arch, thinking about the big toe. I probably got you. You okay?
Yeah, it's okay. It always hurts to go that way though.
Let's start here. No cramping.
It's all good.
The only challenge with a little bit of working aggressively on the arch is to not cause the cramping. So usually where that will happen is, and this is a place where sometimes I limit the active movement piece, because it's the compression plus active movement where people will cramp up. So I tend to defer to doing the passive movement. And I'm just searching, really a little bit, something more through here, or if I have something more.
Before.
Oh, see, you gotta just listen to them. I saw the eyebrows move.
I know.
That
Right
feel
there,
familiar?
right there.
Okay. That's what you want to be. But you need that feedback, okay? You got to really make them give you that immediate feedback. Now, I'm going to just passively move the toes into flexion, because that's actually going to further shorten what I'm pushing on. That should be the position of ease. What I'm going to try to do is a passive positional release. I hold the spot, I'm still on it.
Mhm.
And see if curling the toes makes it feel any better.
Yeah.
And I like to think that I'm right. Hold for positional release. Hold for like 10 seconds. Gotta hold it for a while. Maintain your compression. Then we'll come into a lengthening. Seem better?
Mm-hmm.
The happy frowny face said yes.
I was like, wow, that felt better.
Positional release. So for self-care, explain to a person, you could grab a golf ball, find these spots, curl your toes, make it feel better.
Not as good as before.
Not as good as before. I'm on a different thing.
Mhm.
Is that feel familiar there too? Not as much?
Not as much.
Okay.
That feels good though.
Big toe. And once you've encouraged a person to just give you that feedback, usually they'll just offer it so much more genuinely, right? Okay, cool. And then this is where trying to get that line between the two, because I mean, feet are tough. So, grr.
It does look like you're cranking so hard, but she's doing the same thing over here. And I'm like, yeah, that does feel good.
Yeah, you got to remember, these are carrying us around all day, every day. If a person walks in and they're not walking with a bad limp, I'm just not too worried. Now, it's a little bit of, you got to be cautious. Do be cautious, but this kind of stuff, you got to get things to move. So don't come in and be, the biggest thing is not to be very sudden and fast, right? Now, that's it looks fast, but the actions are not big. I'm not doing that. I'm doing that. So it's just tiny friction. Keep it small and controlled. All right, let's go ahead and flip you on your other side. Real time, how I would actually deal with this stuff. So here, pull, already doing lymph drain, lymph drain, lymph drain, less, lymph drain. It doesn't have to be a push, it could be a pull. Okay. Going into some knees. Okay, finally getting my feet set. Just lateral to the tibia. If I need to exaggerate the pull, I straighten my front leg out and bend my opposite leg. Okay. Lateral to the tibia, big pull. Okay. And forearms. Here. Yeah, I don't use my hands. I have to show you guys so you can see what I'm up to, but I can use my forearm to do that all too. Push, little push. Just be careful because you want to build up your coordination and palpation sensitivity with your forearms, right? Here. I do this in part so they don't slide away from me. Then then I might as well make that additionally count for something. Okay. Then, hand underneath.
It just looks so weird.
Right. This was always a huge winner. The more targeted.
You mean you want? You grab it. Hold that.
It feels like this way you could use more pressure than the other one. The other
I
one
bet.
felt kind of like,
I'll come under.
More ouchy, yeah.
yeah.
Which makes sense.
Mm-hmm.
Now, that's the other point to consider here, too. The easiest way for you to actually inadvertently hurt somebody is that you worked on the symptomatic area in only one position, from one angle. Because then you're just tenderizing that spot by just hammering away on it in one orientation from one angle, using only the same part of your body again and again. So by being sure that you're working on the feet twice, but in a different orientation, you're already limiting the chance that you're going to cause any like adverse effect. Usually what you're worried about is making something feel like it's sore or bruised, right? So here, just a matter of, and I don't have to worry about this foot as much, and it's a big difference. So, I know I've already talked to you before, but my best self-care option with like foot stuff, I mean, Epsom salt soaks for the hydrostatic pressure water, you know, the mineral water is great. One thing I saw the athletic trainers do is they would take 2 golf balls and tape them together with that vet tape or even kinesiology tape, and then you could use that to step on. And we would couple the two together. We'd put the golf ball thing in the foot bath, and then the person could kind of massage their foot while the heat and the magnesium and sulfur of the Epsom salt. So if it's a chronic enough issue, that's an approachable and very soothing, feels good, multi-action, because the pressure of the water is doing lymphatic drain, maybe the magnesium and sulfur is getting in, but that's what I would usually suggest, is something like that. Just pulling everything away, pulling everything away. Now we're going to get just a touch more targeted, related to that tarsal tunnel, calcaneus medial malleolus. That's where my application is going to start. And I'm going to follow the tibia up. I want to be pretty close to that tibia now. You should be reaching a point where you can be right by the skeleton, but not like putting the pressure directly into it in that ouchy bad way, right? When you practice with each other and with your lab rats at home, be sure that you're distinguishing the difference in areas so they can give you that feedback, because that's a common area when you're starting to work in these deeper parts where you're closer to the bones. The nuance is to try to be between, like prying the muscle away from the bone and not being on the bone. And it's just real subtle to be able to pull that off. So you need the feedback. So it's not quite a pin and a stretch, it's a pin and a ton of movement, you know? It's the one place that I will kind of really use those knuckles. Here. to cradle the foot, bolster the toes, bring that forward. Now here I kind of change my orientation because I'm trying to be right there at where that tunnel is. Pull everything away. Perpendicular, parallel. Perpendicular,
We have our other little cupping things. These ones.
parallel. All right, good twitch.
Yeah, it was good.
Did you ask me about that sleep twitch?
Yeah.
Yeah. Sometimes it's a not bad kind of relaxation twitch. So real tiny, 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 just move your big toe or all your toes back. Might be hard to move just no cramping.
Some people like to use this for their.
Try to go into extension. The other way. Go the other way. Go up. Your toes up and away. There you go.
It kind of hurt to do that though.
Okay. Let's be much more cautious. Don't suddenly get too brave.
That's not it, right? You want me to fill out the paper first and then go for it? Yeah, that's fine. You do whatever works. Okay.
Take time.
2:45.
One more. And don't overwork it. Remember, I worked on this with the point work on the other side. So it doesn't need everything right now. And that's the value of doing it in this orientation. So we're gonna do one more. It's really medial. Would you tell me if I'm making guesses and you can't diagnose, you're never certain of anything? I get the impression it's more related to it after I saw the movement struggle. And this would just be something that has to be chipped away at. It can't be done all in one session. I think it's more related to the big toe, which it sits so much next to everything. The muscles that move all the toes and then the muscles that move the ankle. So, I mean, once one goes, everything tends to get frozen up. But,
Yeah, because when she moved her toes up, her big toe still kind of stayed down.
yeah, exactly. And that's what I saw. That's what I observed. I didn't feel it. I saw it. So then there are some homework things where ultimately all it is can you flex just your big toe and extend your other little toes and then flip it? Can you bring your big toe up into extension and flex your little toes? That's the way to try to keep those lines freed up, is the therapy. Okay.